Dr. Oz, I was listening carefully to your remarks, and you talked about cherishing Medicaid, and I think that's a very good sentiment. So I want to ask about how we're going to do that. Will you agree this morning, since you want to cherish Medicaid, to oppose any cuts to the Medicaid program? And I want a yes or no, because we all agree that we need to do more to fight fraud and such matters. But what I want to know, yes or no, is since you cherish Medicaid, will you agree to oppose cuts in the Medicaid program?
I cherish Medicaid, and I've worked within the Medicaid environment quite extensively, as I highlighted, practicing at Columbia University.
That's not the question, Doctor. The question is, will you oppose cuts to this program you say you cherish? Time's short.
I want to make sure that the patients today and in the future have resources to protect them if they get ill. The way you protect Medicaid is by making sure that it's viable at every level, which includes having enough practitioners to afford the services, paying them enough to do what you request of them, and making sure that patients are able to actually use Medicaid.
Let the record show that I asked a witness who said he cherishes this program, will you agree to oppose cuts? And he would not answer a yes or no question. Let me ask you about rural communities, because they get hit by Medicaid cuts if they go through like a wrecking ball. I mean, it is going to be devastating to rural America. We've got a lot of senators who care about this. The Oregon County with the highest share of residents who get their health insurance through Medicaid is Malheur County on the border with Idaho. By the way, this is an area that Donald Trump won in the election by 70%. So, because I want you to be able to do more to actually cherish Medicaid and help people, I'd like to invite you this morning to come visit Malheur County if you're confirmed and see what this really means to rural communities. I've had more than 1,100 of these town hall meetings, and we'd make you the guest at one if you're confirmed. Will you come?
If confirmed, I commit to visiting with you if you'll teach me your jump shot.
I like that part, but I'd like to know, will you come to Malheur County? I can make sure there's a basketball court.
I promise you I will be with you in Malheur County or everywhere if you wish to travel within Oregon.
Okay. First 60 days so we can do it while it really counts when these cuts are being debated?
If you don't mind, I just want to ask somebody within CMS what the rules are, but if I'm allowed to do it, I'll be there in 60 days.
All right, good. Let me ask you now about how we're going to rein in DOJ, because people often say that, you know, I'm a privacy hawk, and I like that. But the fact is, everybody in the Senate is a privacy hawk because of DOJ, because we are very troubled about the prospect of DOJ going in there to this treasure trove of healthcare data that has all the information on these patients. What are you going to do more to protect them? Because right now, we know nothing, let me repeat that, nothing from this administration about how they are going to protect the patients. And we have asked and asked some more. What are you going to do, if confirmed, to protect people against overreach by DOJ on healthcare?
Senator Wyden, I, like you, have not been involved with DOJ. I am only reading in the papers and keeping up the news in that fashion. I have treasured building teams my whole career. The first thing I am going to do,
so you have talked to no one in the administration about DOJ to date?
No.
Didn't talk to Secretary Kennedy?
No.
Never talked to him? Okay. Go ahead, please.
I know that in order to run a large organization, you have to get people excited about going to work. They have to see the vision that you have, and there's a fine line between vision and hallucination. Other people have to see it for it to be a vision. So I intend to spend my first precious few weeks in the agency, if confirmed, speaking to the staff, raising morale, getting people excited, and addressing what's going on with DOJ. I will know a lot more if I'm confirmed by this committee.
Do you think this ought to be a priority issue for you if you're confirmed? Is doing more to protect privacy at DOJ?
I'd like to know more what's going on with privacy at DOJ. I've read the CMS homepage. The website says that only people who have gone through a training program are allowed to see the records, and they can only read the records. They can't touch them.
I've got one last question. Do you believe in a nursing home there should be a registered nurse available around the clock 24/7. The reason I ask this is because that is the rule that is coming up, but there's going to be an effort to roll it back. So do you think we ought to have nursing homes without nurses?
Senator Wyden, as you know, it's a complicated question.
No, it's not. We need a nurse in a nursing home. Not too complicated.
I actually think we need a nurse who will work in a nursing home. And in many nursing homes, that's become a problem. So I believe we can provide quality of care equivalent to having a nurse in that nursing home using tools and technologies, including telemedicine. I want to be flexible enough so that we deal with a massive crisis that we spoke about briefly yesterday. That we have a lot of people aging. In the opening statements, it was pointed out that we're going to go from 68 million people on Medicaid to 90 million people on Medicaid over the next decade. So I want to ensure, and if it's confirmed, I would like to focus on this issue, dealing with older people.
My time has expired. I would only say that right now the proposal gives rural communities 5 years to come into compliance. So I think we can get this done. But if you're confirmed, I hope you won't take the nurses out of nursing homes, because there's going to be an effort in the Senate to do that, and I'm going to be opposed to it. Senator Grassley.